Hi, I'm Dr. Gary Hoffman, and I'm a member of the Center for Vasculitis Care and Research here at the Cleveland Clinic, and I'm also a professor of medicine at the Lerner College of Medicine. We have put together for you a series of videos that describe different forms of vasculitis that you can see separately from this recording. But I wanted to give you an overview of vasculitis in general that would help to put in context some of these other teaching exercises. Let me first tell you that for each of the different kinds of vasculitis that exist, extraordinary strides have been made. Many of these different forms of vasculitis in years gone by, not that long ago, 50 years or so, were fatal within short periods of time, and now death from some of these forms of vasculitis is very uncommon. We've developed new treatments. We've created an approach diagnostically and therapeutically that leads to minimizing damage and saving lives. In fact, it's fairly uncommon for our patients with vasculitis to die in this day and age when diagnosis is made promptly and appropriate treatment is provided. Having said that, I don't want you to go away thinking that we have a complete understanding of vasculitis, because we do not. I want you to develop an appreciation for what we struggle with in trying to have a better understanding of these diseases. So let me give you just an example. We, in a simple-minded type of way, but a useful way clinically, we separate these diseases into small, medium, and large vessel vasculitis, as if to say that if you had a large vessel vasculitis, that every large vessel in your body was an equal opportunity area for injury and creation of disease, as long as it was a large vessel. And that's clearly not the case. There are certain diseases with large vessel vasculitis, like those involving the aorta, the main highway coming out of the heart, where the propensity for injury is in the first part of the aorta, but not so much the third part. We still call that vessel the aorta. We still think of it as a large vessel, but all segments of that aorta are not equal opportunity for injury. The same with small vessel disease. So there are certain types of vasculitis that involve the very small vessels of the circulatory system, but not all equally. So I could give you examples of some forms like granulomatosis with polyangiitis that we also call Wegener's, that has a propensity to involve the sinuses, the nose, the lungs, and kidneys especially, but usually spares certain organs like the pancreas or the brain, although there are some rare situations where those areas can be involved. And the same would be true of microscopic polyangiitis, where we don't often see involvement of the pancreas or the brain, but where we see frequent involvement of the lungs and the kidneys. There are certain types of vasculitis that have a great propensity to involve the skin, but not other small vessels in other territories. But still, we classify these things as small, medium, and large vessel vasculitis, as if each of these categories was an equal opportunity area for injury, small vessels, all vessels anywhere in the body that are small, possibly being involved, which is just not the case at all. And that probably tells us something about the fact that even though they're small vessels, those small vessels in the kidney versus the lung, versus the brain, versus other areas, they all, under the microscope, actually look different. They have different functions. But what we don't know is why some of these organs are targeted, where a welcome mat has been put out for injury, and other diseases where even though small vessels are vulnerable, the welcome mat has not been put out. So an example of that would be hepatitis associated with cryoglobulinemia, which are abnormal cold precipitating proteins that affects the small vessels in many places in the body, but almost never involves the lungs. So a small vessel vasculitis that spares the lungs. So why is that? These and many other questions befuddle us and are the source of questions that lead to ongoing research. I think when we get a much better understanding about why certain organs are targeted, certain organs are spared, and what is it that drives the vasculitis process in general, we'll be able to come a lot closer to an era where we can talk to you not about just the extraordinary disease control that we've been able to obtain in this day and age, but where we have such a good understanding of these diseases where we can begin to talk about possible cures. That's what we're working towards. That's where we hope to be in the not too distant future. Thank you very much for watching, and I hope you will enjoy the other videos that we've put together for your education.